I hear you. Hasn't switched over though. Hello?
Hello.
Hi, everyone. This is Dr. Nestor Rodriguez, welcoming you for our town meeting, which I'm extremely excited to have a great panelist with me, which I'll introduce you in a second, but wanted to thank everyone for setting this up. This is one of various events throughout the week to bring awareness to the COVID-19 vaccine. Not only awareness, but to address any hesitations, to dispel any misinformation you might have heard, or just to encourage people to make an informed decision, not just something that they might listen in the news or they might just see in social media or from their friend. We wanted to gather a group of people that the community recognizes. They recognize not only just as a friend, but as a community leader and also a leader in each particular field. Because oftentimes, me being Latino as a physician, I can tell you that as soon as we got to leadership statuses, there's less of us around. And I hear that from my patients, and like, I would love to hear your perspective on things because everything I'm getting, I can't relate to, or vice versa. When I go to explain my concerns over the vaccine or COVID in general, or the impact it's had, people look at me like it's a different experience. And there's often this disconnect, which then just disillusions us. And we say, I don't want to do it, or I'm scared to do it. So to put a backdrop to all this, I can tell you from the emergency department personally, as a medical director and ER physician, the devastation of COVID-19 has been pretty close to home. I can tell you I lost an uncle in Brazil due to the chaotic situation that's there to COVID, who was a physician working in the front lines. I got incredibly sick with COVID and subsequently still decided to get the vaccine. And I encouraged all my family and got them vaccinated. And the reason is, if you look behind just in Madison, when you look at Black, Indigenous, and people of color communities, there's been tons of disparities that we are aware of. There's tons of examples that we'll discuss where it's shown that the healthcare system has kind of failed us in some ways. And there still continues to be these struggles in terms of how do we get the right information, how do we get the access, and how do we think about things. Particularly as it relates to COVID-19, there's disproportionate amount of numbers. If you look at people being hospitalized, people dying from it, the number of people of color that have the risk factors that put you at risk to die from COVID are higher. So it's a very important topic to help our communities and to make ourselves healthier. So what I would like to do first is kind of we have tons of panelists here, and I would like them to introduce themselves, kind of give their name, their title, and what kind of one sentence of how they're tied into the COVID awareness project overall amongst our community. And then the goal is going to be, I'm going to take you kind of through a journey of hesitancy as to the vaccine, what disparities have existed, what impact have we felt as people of color with the COVID-19 that might be particular to us, a brief history of vaccines in general, and then some personal stories, and then allow the audience or whoever's listening to ask questions. If not, I have plenty of questions, so don't worry about that. So if I can have first panelists just kind of introduce themselves, and we'll go down the line. Dr. Marcus, I have you right next to me on my screen, so I'll say you go first.
All right, cool. All right, I'm Reverend Dr. Marcus Allen. I am the pastor of Mount Zion Baptist Church on the south side of Madison. We're predominantly African-American congregation. We've been in existence for 110 years. This is very important to me. We've at Mount Zion back in January, we did a panel on COVID, and I think it was very impactful for Black people to see of the Black doctors advocating for everyone to get the vaccine. We've also hosted several, at least one COVID mobile clinic with Dane County, and we partnered with SSM Health to help people to get their vaccinations also. So I am an advocate for it, and I believe that we all need to get vaccinated as soon as possible. Thank you. I guess I'll go to Lisa, see next to me.
Good afternoon, everyone. My name is Lisa Imhoff, and I work at the School of Pharmacy. I'm the Associate Dean for Diversity and Inclusion. This kind of hits me from educational perspective, wanting to get our pharmacist practice ready to serve communities. I identify as biracial, and I have two family members, Vietnamese, who got very sick with COVID. My mom actually ended up in the field hospital in Milwaukee, and she's from Madison. So that impacted my decision. So I do think our pharmacists need to be ready to talk to communities of color about their fears and concerns. So that's where I'm coming from. And I will turn it to Cheryl.
Good afternoon. I'm Dr. Sheryl Henderson, and it's great to be here with another town hall. I am a pediatrician. I work here at the University of Wisconsin Hospitals at the Children's Hospital. And as an infectious disease specialist, I have worked with viruses, primarily HIV, as well as vaccine clinics. And as you know, pediatrics is it's very important to have our kids vaccinated for a lot of pediatrics. When COVID-19 came on the scene, I became involved with one of the vaccine clinics that was run here with Dr. Hartman as a primary investigator, and really found how important it was to bring the facts about vaccines to our communities. There's a lot of misinformation that we're aware of, but then also information that changes as we learn more about this virus, as well as our body's responses to it. So, it's important to just keep coming back and hearing concerns and questions from you to make sure that we get the facts out. And I will ask Dr. Jasmine Zapata.
All right, hello, it's great to be here. I'm Dr. Zapata. I'm a pediatrician at UW Health, and I'm also the new Chief Medical Officer for Community Health within Wisconsin Department of Health Services. So excited to be here. This topic is important to me from a professional standpoint, but also a personal standpoint. I lost a loved one to COVID last year, and then also I got COVID along with my mom, my husband, and one of my 3 children all at the same time. And it was very, very scary. So I've been doing a lot of work as it relates to just having community conversations like these. And also I'm one of the co-investigators on one of the vaccine trials that's going on at the university. So for many reasons, this topic is important to me, and I'm just so happy to be here to have continued conversations. I'll pass it to Pastor Sierra.
Hello, my name is Marcio Sierra. I am the pastor of Lighthouse Church here in Madison, a church that serves mostly the Latino community. Since COVID started, I've already done 3 funerals that are directly related to COVID. I've had many of the members in my church whose family members are in Latin America who have had family members who have passed away. There's a member of my church, for example, that had a sister pass away on a Monday. The other sister passed away on Thursday, and the father passed away on Friday, all in the same week, all related to COVID. I had to deal with this family, be able to help. I got COVID. So this is very serious for me. Lighthouse, we were a testing site last year. We're also distributing masks. Just this past Saturday, we were actually a site where you could get the vaccine, thanks to the Boys and Girls Club and other organizations. So we're just creating awareness. There was a time that I could count. There were 53 members of Lighthouse Church who had COVID. I was trying to call every single one. And it's something that is real, something that we're living. And when you come from Latin America, you see what all these countries are living, and they don't have access to a vaccine. We have access to a vaccine, and it's almost like, sounds bad, but what a waste. We have the vaccine and we're not using it while we see our family members dying because they don't have it. So I'm here to promote it, to talk about it, and to advocate. And I will pass it down to Peng Her.
Good afternoon, everyone. My name is Peng Her, and I'm the CEO for the Hmong Institute. Thank you for having me. We primarily work with the Hmong and Southeast Asian community, which include the Lao, Khmer, or Cambodian community. Also, we work with the South Asian community, which is the Tibetan and Nepali community here in Madison in Dane County. For me, it's really personal because in our community, and like in many communities of color, we're a very social community. And so we tend to have large community events and gatherings. And one of these in particular are funerals. And so when a person passes away from COVID, most funerals generally are large in size, and other folks come and they themselves contract the COVID virus, and they also pass away. So it becomes this cycle of people going to funerals who the person passed away from COVID, and they themselves contracted from other folks. And so we wanted to find a way to really help educate and make sure we get correct information to our community. And so some of the things we've done is created a statewide COVID-19 hotline that folks can call in and get accurate CDC information about COVID-19 as well as the vaccine. We also was a test site early on, and then we became a vaccine clinic. We are hosting vaccine clinics. Actually, we're hosting one as we speak right now. We have about 60 people signed up to come through this afternoon, evening to get their vaccine. And one of the things I decided to do early on was get vaccinated myself too, because I wanted to show our community that it is safe, and it's there to, the vaccine is there to protect us from the getting more deeply impacted by COVID virus. Secondly, I hope that by myself getting vaccinated, if folks look at me and says, oh, here's Peng, he's got 3 kids and he got vaccinated, so I should go get vaccinated too. And so by getting vaccinated, I hope to encourage other folks to get vaccinated. So with that, I'll turn it over to Shiva.
Thank you so much, Peng. Shiva Bidar-Sielaff. I'm the Vice President and Chief Diversity Officer for UW Health. It's really an honor to be on this panel with all of you who I know from so many amazing things that you do in our community. So in my role, actually, I was on the incident command for UW Health for COVID-19 since the beginning. And it's really been the most difficult, challenging, and also really life-changing ways that I've seen COVID play out in our community, in our hospital. I happen to also be the co-chair of the Latino Health Council. I work very closely with our Spanish-speaking patients during COVID-19 that were here in the hospital, and just seeing the inability to be able to even be close to them to provide language access was really heartbreaking for me as somebody who started as an interpreter in the hospital. And I participated in the AstraZeneca trial back in August because I wanted us to have a vaccine as soon as possible. I wanted us to find a path forward, not just for us in the US, but for everybody around the world. Just like a couple of my colleagues already mentioned, my family is also in places where the availability of vaccine is non-existent. And I want to continue doing work in this community to make sure that everybody has access. So I've been working very diligently in education, engagement with, again, colleagues here on COVID-19 vaccine, and also creating access for COVID-19 vaccine with a very, very specific focus on racial equity. And I will pass it on to Corinda.
Hello, everyone. My name is Corinda Rainey-Moore, and I'm the Community Engagement Manager at Unity Point Health Moderator. And I'm here because I want to make sure that we are getting the information out to folks so they can make the decision for themselves whether or not they want the vaccine. Now, I agree that everybody should take it, but I know that folks are not going to take it without adequate information, but also knowing certain people who have gotten it also. So I want to make sure that folks have access to information, but also access to the vaccine. So my role at Moderator is focusing on all things external. And so meeting with folks in the community, providing education around COVID-19, and also coordinating vaccine clinics with folks is also part of my role. So for me, it is also personal because I know several family members of mine have gotten COVID. Luckily, no one has died in my family from COVID, but they have been really super sick. And some of them are still recovering right now. But I also had a lot of friends who have died from COVID last year. One of them, and many of them, were very close family friends. And for me, it was heartbreaking to not be able to celebrate their life the way we typically do in our communities, because we like to celebrate folks in a big way, and not being able to do that to me was heartbreaking. But the most thing that really got me thinking about COVID and wanting to really make sure folks have access was because I lost both my stepdad and my father-in-law within a week of each other at the end of last year. And this is having not seen them for a whole year, because we were trying to make sure that we didn't get them any that we didn't impact them in any way with symptoms of COVID, and wanting to make sure that they were healthy. And despite that, staying away, we didn't get to see them for a whole year, and they both died within a week of each other. And now I have one living parent, and I do not want to wait another year before I see my mom and spend time with my mom. So that's why I got the shot myself, because my mom is getting of age, and I just want to be able to see her and not having to wait any longer. So it is my goal and my mission to provide folks with as much information as possible so that they can make the decision for themselves. And so I've been working really diligently with Shiva, Lourdes, and some other folks on here to make sure that we are answering people questions. So we developed that FAQs. We made videos as well, acknowledging with folks who look like folks so that they can have that information as well. So we're just trying to make sure we do whatever we can so that folks have the information that they need so they can make the decisions. And in addition, we've hosted panels. I participated with hosting a panel with Pastor Allen, but we also hosted a panel discussion with the Urban League so that folks could see folks who look like them and answer questions from folks who look like them as well. So that's why I'm here. And so I pass it to Lourdes.
Hi, Corinda, and thank you. I'm sorry my camera was off, but you know how things are when I have a presentation, my connection is unstable. So thank you so much for the invitation to be here today. My name is Lourdes Shanjani, and I work with Public Health Madison and Dane County in the role of Bilingual Health Education Coordinator. When COVID hit last year, I was working at a local health department in the state of Illinois. And when we transitioned into that incident commander response, I help with contact tracing and also connecting with our long-term care facilities. And in my current role with Public Health Madison and Dane County, I work very closely with some of the partners like Corinda mentioned and Shiva Bidar, doing education and information, providing information in our community. And as a member of the Latinx community myself, I have seen, as Pastor Sierra mentioned, a lot of people around me in my family, my community getting sick and losing their lives because of COVID. So besides the fact that I believe in vaccines and I feel that I have the information I need to make a decision, I decided to get vaccinated because I think, you know, it's the way to get out. And I've seen it firsthand within my community as well. So hopefully we can have a really rich conversation today and we can get some people that information they need to make that decision about vaccines. I think everybody has gone, so I'll pass it on to Nestor or Nate, maybe.
No, I think everyone.
No, Olayinka hasn't.
Yeah,
Oh, Olayinka, sorry.
that's okay. Hello, everyone. My name is Dr. Olayinka Shiyanbola, and I'm at the School of Pharmacy. I'm an associate professor here, and I do a lot of work, and actually I've been studying health literacy and misinformation, beliefs and myths that people have about medicines for a really long time. And so I come into this with both a personal and professional standpoint in what are the best strategies and communication strategies to address misinformation, and what are the best ways to communicate with people to increase vaccine confidence. So COVID is, it touches me in a couple of points. I actually lost my father-in-law to COVID, and it was really sad because we were not able to, it's very similar to what I've heard, celebrate him. And also because it was thousands of miles away. So it's very important for me that now that we see a solution, which is a vaccine, that I talk to my family members to also please get the shot. Also professionally, I've also been doing a lot of work. When COVID happened, I do work with people with diabetes, especially African Americans. And when COVID first happened, there was a lot of misinformation that if you have diabetes, you are likely to get COVID. And so we started doing videos, we started doing series, talking to people. Just because you have diabetes does not mean that you're going to get COVID. It increases the risk of complications. And so trying to address that in the best communication manner that actually is tailored to the group. And as well, I've been working together with the Boys and Girls Club as well in increasing access to the vaccines for the past couple of weeks, going to communities of color where they live, where they work, to increase access to them getting that shot if they want to get the vaccine shot. So I'm happy to be here and also be part of this panel.
Awesome. So needless to say, one of the things that just having to listen to everyone here, everyone's accomplished, everyone's a leader in the community, which you rarely get this many people in one room. So with this virtual Zoom, if I was an audience with the younger me, it would be inspirational. And I would look up to you guys and your guys' advice and words, because those would be people I aspire to be, or those are the people that are, you know, working through the system to make things accessible to us. So like I mentioned, I'm going to ask questions. And the first one is, COVID hit us. It was unexpected. It was devastating. It's here. But prior, or when it first started coming out, you know, the initial questions I was getting, I'll use my family, I'll throw them under the bus, so to speak. They were saying, well, hold on, I don't even know about that vaccine. I don't want it, right? And we heard a lot of it, a lot of my patients, irrespective of when it was being developed, why it was developed. And I think from the historical and contemporary kind of context of one, systemic racism, you know, marginalization, and then kind of research and some of the negative aspects that have kind of occurred in the past. So before we even get to COVID, I think one of the big kind of elephants in the room is, well, why am I already coming in as compared to my white counterpart already doubting some of these treatments, right? And I think that's the first thing I wanted to just kind of acknowledge and bring up and see, and I'll have Dr. Zapata, my colleagues here, I'll kind of throw the question to her. If she can speak to that, to the historical aspect that kind of got us to this, where I believe that people of color, we're already a little bit more hesitant than our white counterpart. And how do we hear that? How do we acknowledge that difference so that we can start moving forward, right? Because there's going to be other challenges as we move forward, but how do we close that gap? And why do we have that gap?
Yes. Great question. I'll let some of my other colleagues speak on this too, but just in a broad sense, communities of color have been, I will say, betrayed by the public, our own US public health and medical systems over the last hundreds of years. And so we didn't get into our current situation that we're in overnight. And what we must acknowledge is that we're not going to solve the issue overnight. We can't just have one community conversation or a public service announcement telling people, get the shot, and then just expect everyone to trust us, because we didn't get in this situation overnight. We're not going to fix it overnight. It's going to take continued conversations to rebuild that trust. And some people would argue that, was there ever trust in the first place? Do we need to earn it and start from scratch? So we just need to be patient in this process and continue having conversations like these.
Perfect. And I would ask the same question to Lisa and Shiva to see what their perspective are from different, obviously, communities also.
Sure. I think, from my lens with the education of pharmacy students, I try to raise awareness with them that historically everyone knows about Tuskegee and the syphilis experiment. I feel like everyone but there was also the Havasupai at University of Arizona, where they went into indigenous communities and asked for their blood samples, saying they were going to do a study on one disease state. But what they did with those blood samples was, study a whole host of other things without their informed consent. So we're really trying to, educate folks that systemic racism has been around from the inception, like Dr. Zapata has said, and it continues to happen. And we see that with Dr. Susan Moore, who passed away, having her last breath, saying, "I can't breathe." And they didn't listen. The doctors didn't listen. So this is, past and current.
I would just add to say that, as we talk a lot about the historic, right, which is absolutely exists, but the reality is that currently in the US healthcare system and in all aspects of our society, racism exists. And so we need to just also acknowledge that that is the current experience, right? So when we are coming out and saying, hey, no, this one is really it's not going to hurt you, this is really great. When people's experience is that there are things that are being done that are harmful to them in their current interaction with all systems, including the health systems and government systems, we just have a long ways to go to, as Dr. Zapata said, earn that trust. Why should they trust us on this one if on many other levels we're failing people? And one place where we failed people was in the disparities in COVID-19, right? We just failed as a country and showed that there is racism, and that one way that it showed up was in the disparities in COVID-19. And now we're saying, well, this one is the real thing. So we need to acknowledge that that's the reality that people in communities are talking and thinking about.
Perfect. And I also would like to get Peng Her to kind of, in terms of his perspective and his community, if he can mention a couple of words to that along these lines.
Thank you, Nestor. Yeah, I think for the Hmong community and the Southeast Asian community, one of the challenge historically has been back in their native country, when there's vaccination or immunization, they're rounded up by the military, right? And so you fast forward to here when we're doing the test sites at Lion Energy Center, or even the vaccines now, we've had the military or National Guard helping, right? And so it's those flashbacks about being rounded up for many of our elders, about hesitancy to even get tested, and now with the vaccine. Secondly, another issue is when the Hmong were relocated to refugee camps in Thailand, oftentimes the first time they were had contact with a Western doctor was at the refugee camps, getting whether it's their immunization for polio shot or whatever shot they needed to come to America. These doctors made fun of them because oftentimes they thought we were primitive because we would decline Western medicine versus wanting you to use herbal medicine. And so they would call them names and call them ignorant. And so that in itself created a lot of distrust for Western doctors way back in the refugee camps. And the third, what I've also heard is coming here, and when you're 5'2" like myself, and I weigh about 100 and some pounds, and you're getting the same dosage based on what Western medicine uses as the model as a white male who's 6'2" and 250 pounds, we question, why is someone 5'2" getting the same dosage as someone who's much taller and much heavier? And so we question, are we getting the right dosage, whether it's the vaccine shot or just some other types of medication that you're taking for whatever, if it's heart disease or whatever other ailment you have. And so those are things that cause particularly the Southeast Asian community to be a little bit more hesitant when it comes to the vaccine.
And that was a comment for me, being born in El Salvador, having immigrated to Los Angeles, some of my family members, being, I guess, illegal, so to speak, or undocumented. There's also the concern of, how does that status play in, right? How has that status of foreigner designation played in historically in healthcare? And is it safe, right? Because yeah, it's free, but free can mean different things to a million different people. So time taking that into light. So knowing that historically, hey, we have all this, and like Shiva mentioned, a lot of times when we mention it, and she kind of led the conversation for me, was we always just say that's historical, but it is here now, right? And when it's here, we tend to forget about healthcare because there hasn't been that big Tuskegee Institute recently, right? Because there is that someone's kind of talking in our ear, yeah, that's probably not right, and it's going to look even worse if it comes out in healthcare that wasn't, 50, 20 years ago. However, there's still that systemic challenges, the access. So now we're here, right? So how do we make, as healthcare providers or community leaders, what can you guys mention, and I'll keep it to the same four that just spoke right now. Can you mention specific examples within your healthcare systems or work in terms of that you could turn to people and say, hey, this is how we're addressing, or this is how we're trying to build the trust from a healthcare system, right? Because a lot of people know faith groups are doing it, community groups are doing it, right? Because that's their bread and butter. Healthcare, we don't lead with that. That's not our, we have diversity officers, education, we have them too, but that's not our go-to. That's not what we kind of put our step forward. So can you guys speak on that and mention some examples now to show that, hey, tides are changing. They're not where we need them to be. And how does that relate to COVID? Shiva, I'll put it back to you.
Okay, so interestingly enough, even though, so let's go from what we said to just also talk about the fact that actually in national surveys that have been done, Black and Latinx, I use those two specific groups, have said over and over that the place that they trust the most to get their vaccine at is actually at their health clinic, usually their primary care clinic. So that is actually continues to still be the most trusted place. So I think that, again, because the issues that they were talking about, these systems of racism exist in all systems, right? But I think that at the end of the day, again, primary care clinics and health systems and public health continue to be the most trusted sources of information, especially when there are people within those systems that really have been involved in their communities, represents those communities. They're not just showing up to say, oh, here we are with the minivan, like now we're showing up, but have been in the communities before. And so as I look around this table, a virtual table, people like, Dr. Henderson, Dr. Zapata, Corinda, Lourdes, that are part of health and public health, Lisa, but have been in the community before. And so they're known to the community, are being really critical. So I would just say that I continue to think that trust that them, and doctors continue to be some of the most trusted people by everybody across race and ethnicity.
If I may add, I would also like to add something. I want to concur with what Shiva was saying. We have seen some data in our communications team about where people want to get the information from. And we have seen that people are reporting they want to see other people of color in white coats, so doctors, talking to them about how safe the vaccine is and how effective the vaccine is. So yes, it is important that doctors, and especially doctors of color, like people that look like us and can talk to our community, can have those conversations. And also, like from our standpoint in public health, I think that it is important that we are also mindful about the past harms that have been, done in our communities of color. And also we take ownership on that, that people that have direct experience with racism or indirect experience, whether it's like by a family member or neighbor, they are going to have like probably a negative relationship with the health systems in general. So if we approach these conversations from a humble place, be mindful of that dynamic, and really wanting to share information for people to make decision, right? Because that's what we are all trying to do. And Corinda said it earlier. We want to empower people to make a decision. We want to share information so they have the appropriate information to make the decision. So it is really important that we all acknowledge, there is harm that has been done. There is mistrust and distrust, but we are working. There's a lot of people that you can see here that are working to make that better in an intentional and meaningful way.
I'll jump in onto what Lourdes said. I think it's super important for us to be thinking about, where are healthcare providers getting their training? And it starts with education. And if they're not getting this within the curriculum, they're not going to be, prepared to serve communities. So what I'm trying to do in our curriculum is help them understand that you can't just position yourself as the expert and say, take this drug, it's good for you, I know better. Like Lourdes said, acknowledge the past harms, but help them weigh the pros and cons, listen to their concerns versus the historical way is like, basically, you're an idiot, you're ignorant, I think or you're an anti-vaxxer, and treating communities of color as a monolith with the other people who might be vaccine hesitant. So not understanding the cultural nuances and the past harms, right, and lumping them in as anti-vaxxers is very harmful. So I like what Lourdes is saying is really listening to people and where they're coming from.
If I could just add on to that, I think one of the main things that when I talk to physicians and patients is, how do you build that trust with a patient, right? Because if you don't have that trust, then patients aren't going to listen or follow what your prescription is. And so one of those ways to build that trust is for the physician to really understand the cultural beliefs of the patient, right? And make sure that their prescription or what they're prescribing really takes into consideration and honors the cultural belief and cultural practice of their patient. This will help reduce that mistrust, and thus the patient is more willing to follow the advice or take the prescription of the main provider. And what I'm seeing is physicians now are more and more willing to be more culturally responsive in serving their patients, both the physician and the healthcare center. And so two prime examples are my children were born at St. Mary's Hospital, and they recognize that in the Hmong community, when a mother gives birth, the next 30 days, they are on a strict organic chicken diet that helps replenish the nutrients that the mother lost. And so many of the hospitals here in Madison now recognize that, and they offer a chicken diet, we call it, to Hmong mothers who recently gave birth. And so this is how we can help build that trust. And one of the things that we're doing at the Hmong Institute is hosting an annual Hmong Health Summit, really geared towards having physicians and folks in the medical field attend to be more culturally responsive in serving their patient and understanding the Hmong beliefs, that we believe that each person has three spirits in them. We also believe in reincarnation. And so when a Hmong person declines surgery, it's not because they don't trust or mistrust the physician, is because they're thinking about the next life and what that surgery will have impact when they're reincarnated. And so by taking more of these types of trainings and courses, it helps both the physician be more culturally competent, as well as helps build that trust with the patient to be more willing to participate in the prescription and the advice of the physician also.
And I would also say in terms of what you guys have mentioned, and being intentional about it and teaching those scenarios, because it does start at the medical school level. And I've seen a drastic change. I used to be in academics and would run a residency program at UW, and UW did work at creating those cultural competency curriculums. And I can remember the first couple of days, the year, we're like, oh, this is fluff, or like there was one case that everyone knew and we're like, okay, that's not abuse, or no, that's a Jehovah, that's what they're going to ask us. And that's kind of the extent of what cultural was, right? Versus expanding it to see like culture is more examples, it's listening, it's taking into consideration that not all Latinos are all created equal in terms of like their experiences, but into listening there. And also I think then translation of that information, right? The biggest thing that I've seen, and I've seen you guys all from afar, is working on how do you get that information out in any given language or in a way that they can understand it. Because there's certain people that can take all the stats, and there's my mom, who you give her the stats, she doesn't care about stats. She's like, am I going to live or not? Is this going to make me sick or not? Right. So in terms of how do we communicate those statistics that this is safe to the person that is listening to, and kind of healthcare is pushing there, right? Slowly we're moving that direction, but those are some of the things that we keep pushing through also to try to help people believe and do that. Because I know I got to my hospital, you know, anything in another language kind of an afterthought, like, wait, what do you mean? Hey, we have tons of migrant workers here. I can't give them a discharge instruction that says COVID, you might die, because that's all they're going to read, and not the rest of the stuff, right? It's how do we articulate that? So having said that, the other part of it is obviously healthcare. There is that mistrust, but and sometimes people are looking at it like, man, do I want to take it? Am I going to get sick or not? But there's also that social and cultural component in terms of social and economic component that has occurred, right? So I want to turn to Corinda, Pastor Allen, Peng, and in terms of socially and financially and mentally, how has COVID impacted, and how can the vaccine help you or help us get out of those dark places perhaps that we've been, which if you throw stats, and I could throw stats all night if we wanted to, financially, culturally, mentally, we've been impacted more than our white counterparts. Again, not really spoken about, but it exists and the data's out there. So Pastor Allen, I will kick it off to you in terms of what have you seen when we're looking at vaccines, where I was looking at health, but also why taking a vaccine, can it help you mentally, you know, get financially back on track and such?
Right. So we all know once COVID shut down, many people in the Black and brown community wasn't able to work from home because many work low wage paying jobs. So they had to still go to work, or they weren't working at all. So a lot of people were making it from month to month, or some even week to week. And once COVID hit and it just shut some things down and shut their jobs down, it was nothing they could do to make it at all. And so getting the vaccine, how does that help? Hopefully it'll help the reopening of businesses, the reopening of different events that takes place, so people can have those wage paying jobs, so that they can be able to take care of their families. They can be able to put groceries in the refrigerator, and they don't have to worry about handouts and other things like that. So the vaccine will definitely help if people take it. If we get to that, Damon Boatwright said it's not herd immunity, but if we get to community immunity, it allow us to open more things up and have an opportunity for more events to happen and to be able to work their jobs, because people were laid off from some was working 2 and 3 jobs already. And then even we were going around passing out food and giving out gift cards and things. And this lady, I've seen her all the time at my child's school, and I've seen her at the Pick and Save. But when COVID hit, they shut down the schools. And that second job was the thing that was helping make ends meet. But then when the second job was gone, it was that one job couldn't suffice the bills for the house and having a sick spouse at home. So if we're committed to it and getting more people vaccinated, it would definitely help open things up and allow more people to work these low wage paying jobs.
And Pastor Shira too, if you can comment from a Latino perspective, I'd say.
Yeah, one of the things, we live in an age of social media, and social media can be great for communicating, but at the same time, a lot of, stuff gets communicated in social media that is not true. So I'll give you an example, but even though a lot of the things may not make sense, and we can say this doesn't make sense because of the fears and the traumas that many in the Latino community have faced, we, like, I think it was Lisa that said, we cannot just assume, well, what's wrong with these people? Why are they believing this thing? I'll give you an example. There was a church that was doing a testing site. And in Spanish, the church, it was Iglesia Cristiana Ebenezer. And the initials for the church is ICE. So there was this bulletin that said, sponsored by ICE. I mean, it looks like it says ICE. So of course, people are sending, and then I'm doing one of Lighthouses becomes a testing site. And they're like, Pastor Marcio, are you working with ICE? Does this have to do with ICE? And honestly, at first I was like, what are you talking about? And they sent me this brochure and they're like, there's this church, in Texas that is working with ICE. And honestly, I had to do some research, like what is going on here? So there's a lot of misinformation that is going on. There was another in the churches. COVID is happening and there's a lot of misinformation. There's a lot of, we're in the middle of elections. One party is saying one thing, someone else is saying something else. So no one knows who to believe. So and I can say, in the churches, we were at fault also because there's some people saying, Pastor Marcio, this is the mark of the devil, things like that. That, a lot of people in the faith community are saying this. And so I think what we need to do, like Shiva said, is we need to bring trust to the health, to the doctors, to the hospitals, to things like that. But usually it takes some leader, someone in the community that can say, hey, you can go to this place. Hey, you can go to Park Street and do this. You can go to the UW Health. So I think what we need to do is bring a lot of information to the community that is fearful, and rightly so, and explain what is going on. Sometimes just having someone that is Hispanic looking, Latino looking, that speaks Spanish in a clinic makes a difference. I can do something at Lighthouse. My wife is white, she's blonde, she's green eyes. If she's standing there and someone comes, some people might just drive by and they say, I don't trust it. I don't know if I can provide my ID. I don't know if they understand my situation. And sometimes they just need a familiar face to be at a place where they're doing the testing, where they're doing the vaccines, where they're doing the information. So for example, just having this panel, if you put a picture of everything here and they see some doctors and they see Pastor Marcus Allen, they see myself, that already brings some credibility simply because we are there. So I think as leaders, the church, we need to talk to a lot of people. But at the same time, some people were saying, I'm getting sick with the vaccine, this is happening. And I have people in my community, in the church, for example, that have said to me, Pastor Marcio, I was without work for about 6 months. I couldn't pay rent. I couldn't do this. I cannot afford to get the vaccine because what if I get sick? What if something happens to me? And then who's going to support my family? I had a situation where there was someone that actually had COVID and was working. Someone called me, is like, can you tell this person not to go to work? And they said, Pastor Marcio, chances of me surviving from COVID are pretty high. The problem is that I don't have a way to provide food for my family. And actually, there was a group of us that actually had to go to this person's house to try to explain to this gentleman, you need to stay at home. You cannot go. Others can get contaminated. People could die. But this person was crying and saying, Pastor Marcio, I'm going to get fired for my job. I'm the one of the Latinos in this job. Other people can take off. I cannot take off. I don't have the same benefits that other people. If they're going to start getting rid of people, I'm going to be the first one. So people are fearful. People are misinformed. And I think we need to do a better job. And I think many of you are doing a very, very good job, but even in the churches, a better job of informing and bringing the experts. Many times I say, you know what, honestly, I don't know why this vaccine came out so quickly. I don't know what happened. I don't know who did it. I don't know why we have it and someone's not. I don't know why there's a vaccine. I'm from Honduras. They're saying in Honduras, they're getting some vaccine from Israel and that is not accepted here. So what I'm saying is let's bring the experts to our places and communicate the information that people need to listen to.
And that does lead us, Corinda, did you want to say something? If not, it does, I'll take it to the vaccine portion of it.
Well, I just wanted to just kind of say, when Pastor Allen was talking about folks not having access to jobs, I don't even think it wasn't that they just didn't have access to jobs. They didn't have access to childcare, right? So transportation to jobs, because there were people that couldn't get to work because the buses weren't running that frequently, cabs weren't running. So typically folks, if they can't get the bus, they might take a cab if they could afford it, but cabs weren't even taking people to work. So people couldn't even get to work. And so I just wanted us to be cognizant that COVID didn't just affect one aspect of our lives, it really affected all aspects of our lives. We all were shut down. The schools were shut down. Kids who normally would have access to even food from schools didn't really have food from schools. So some folks like Pastor Allen and Marcio stepped up and started doing food, right? And started giving food, distributing food, going into communities. And so when we talk about that, we always have to be looking at it from a cultural lens. I'm just going to say, even when we talk about having access to the vaccine, like we're doing vaccines in the clinics, but I think there was a policy where you because of COVID, you couldn't bring kids, right? Now, does it even make sense for me to take a bus an hour and a half to get an injection that's 15 minutes? That doesn't even make sense, right? Because you have to take the bus for an hour and a half to drop your kids off, if you could drop your kids off somewhere, and then get that 15-minute injection and go back an hour and a half. That doesn't even make sense. So I think we have to always think about, like, even when we think about our policies, how our policies impact people's lives. And even when we try to do the best thing for folks and we have good intentions, sometimes those good intentions are harmful to folks. So I just want us to be cognizant of that and always think that we should be thinking of it from the lens of folks who are diverse and who are marginalized and who often don't have a voice in a space in these spaces right here, because we have to be the voice for folks, which is why I think some of us are here and some of us do a great job advocating for folks, because sometimes we folks don't always think about it. If you haven't lived it and you are not in the community, sometimes you miss stuff like that. Like, what am I supposed to do with my kid? Like, even when I don't know if folks remember, the stores even had a policy at one point where how many kids you could bring into the stores to get food. And if I'm the only parent and my kids are like 5 and under, I'm going to have to bring all my kids with me to the store. I can't just leave one of them at home, right? And because they were asking people to quarantine and socially distance, I couldn't just like say, I'm taking my kids over to so-and-so house while I run to the store. And so COVID, in fact, impacted all aspects of our lives, all aspects of our being, all aspects of who we say we are as humans in terms of our relationships with other beings. We couldn't be with folks. I mean, we can't even have a meeting talking about COVID in person. We're on a Zoom, right? Talking about it. And yet many people didn't even have access to Zoom. So I'm thinking about that. And the schools provided hotspots for folks, but the schools also didn't have enough hotspots for folks. So I don't know if folks know that, but they didn't. They had people on the waiting list. So, and those are things that we don't talk about, and those are things that we don't think about, but COVID changed our lives and probably changed our lives forever.
I agree. And one of the aspects before we move to the vaccine that we haven't mentioned, kind of mental health too. And I would say as a physician, you know, our duty, I know all the good and lows, the highs and lows, the bad, the ugly about being a doctor and the responsibility we carry. I will say also, as from a physician standpoint, you know, I did see the loneliness or the isolation that people in the community got. But also as a physician, where you're now targeted as like, hey, it's your problem to solve. It's on the backdrop of political, it's in the, you're carrying this sword for all of us. Yeah, we're working extra hours, we're working understaffed, you know, and it was an impactful thing where it did hit home, right? It wasn't until I got sick where I'm like, oh my God, And for me personally, I felt bad when people would die. Like they shouldn't be dying on me like this. I should be able to help more, right? And we see death day to day, in the hospital. I'm in the emergency department, so I see it all the time. And it doesn't affect me in the same way as this did, because it was the unknown, or even now in the process, like, man, there's stuff we can do, and we have the capabilities here, right? Versus a third world country or Brazil that I used for my uncle. That was the hardest thing. Whereas a doctor, they're telling me, I'm sorry. I'm like, that's one of you. That's for your own doctor. You're not taking care of them yet. We don't have anything. And I can't fault them, right? They don't have anything. They don't have anything. What can I do? And it did take, when I was sick, to be isolated. I mean, my family was upstairs, and I looked at it like, holy crap, I made it from a single, apartment, government housing with tons of my family. And if I was sick there, the chaos that would have caused. But not to mention, now that I made it, I have a comfortable, like, my basement was nice. It's nicer than a lot of places. And I felt depressed. So I couldn't even, it kind of hit me home where I'm like, I can't imagine someone that's struggling, that has all their family, that has to worry about making finances, has to worry about child care, taking care of the relatives, right? The impact that would have, it's crazy. And we don't talk about that. So which is why I'm such a proponent. Even when I was sick, I took the vaccine 7 days after. I should have waited a little bit, and we'll talk about why. But it reacted pretty strongly to it. So I do want to turn to Dr. Henderson, which obviously now it comes to, like, this is our environment. This is who we are. This is culture. These are all the added things, right, that our Caucasian counterparts may or may not have to deal with, depending on who's in their family. But it does come down to these questions of the vaccines, right? The vaccines are everywhere. As a pediatrician, I mean, yeah. My common question when I would get frustrated and people wouldn't listen, and this is honest, and people might hate me about it, is like, you vaccinate them for everything else. Why not this? You asked me for tetanus, and I'm like, tetanus? I've never seen tetanus here. I saw it in Haiti because they didn't have vaccines. But here, a little cut, people are like, I need my tetanus. But then if you tell them about COVID, they're like, nah, I don't want to do that. And so I would like you to speak in terms of, one, vaccines, in terms of how in the past they've improved lives, and how in particularly, how vaccines improve life in general, I'd say first. And then we'll dive into the COVID and the 3 different types that we have here, which, a lot of people we mentioned it, but if you look across the country, there's other vaccines, right? So we're just dealing with 3 here, but there's more coming. There's more with other risk factors out there, but we're gonna keep it to the US and to the fact that we do have them available. So with that, Dr. Henderson, what would you say to that? How have they improved life expectancy in the past?
So, when we look in the past, and we have to go back over 100 years to when the vaccines first started, there were many diseases around that we just don't see today. Measles, mumps, or we see it, but not in the numbers that they were there before. So measles can be a killer of young children overall. Diphtheria, tetanus, all of these vaccines that are now part of routine childhood vaccinations cause serious illness for people. One of those that there's still people alive today who grew up with kids who were seriously paralyzed or died because of polio. And polio, I think of as one of the major vaccine successes that people who have been living for my age and older have been very aware of, that vaccines can help and can prevent disease. And as a child, I was somebody who, at the school, we were all lined up and we got the rubella vaccine when it first came out. Many of my contemporaries can talk about receiving the polio vaccine. At that time, it was oral, but they really did make a remarkable change. And I can speak a little bit to, well, how do vaccines work? Why is it that these are effective, and why why we don't see these today? And I actually, before I just want to answer, I think that the fact that vaccines are so common, and enough people are vaccinated these days that we don't see the illnesses, that we don't necessarily think about them overall, because if I had a measles vaccine when I was a year old or when I was 4 years old, it's not really impacting my life right now. But COVID came on, as we're all aware, pandemic, many people being effective, and there's many tools to try to prevent the spread. But what we're really aware of is that vaccines are really going to be the major tool to try to block COVID from passing one to the other.
And along those lines, can you speak briefly, and I know it's a tall task to ask, but you're up for it, I know you are, in terms of the three vaccines, what are they, what are their similarities and where are their big differences that people need to know?
Okay. So I think we've all heard about the names, and I will make sure I distinguish it, because a lot of times we say Pfizer, Moderna, and I've had people tell me, is that one or two vaccines? So the first vaccine that received emergency use approval was Pfizer. And then that followed on the heels very closely by Moderna. And then we've had a lot of information about the Johnson & Johnson most recently. But when you look at the Pfizer and the Moderna vaccines came out within a year of COVID-19 being aware. And they are very similar in terms of how they are produced and how our bodies react to them. We know that we say it's an mRNA platform, meaning that the genetic code or the blueprint is mRNA, and that's a blueprint that's within the virus that specifically makes a protein that's part of the virus. So those two are similar in that way, and I'll get a little bit more detail in terms of how that works. But the Johnson & Johnson is also similar in that it also contains a genetic code, but it's DNA, which is another gene, so to speak. But again, all three of them, they're similar in the sense that the code that's put into the vaccine and it goes into our bodies creates a part of the virus, and it's called the spike protein. And I really want to emphasize that it's just a part of the virus. It's not a whole virus. The virus cannot make more of itself, or it cannot cause COVID-19. So those are pretty much the similarities. The way they're made and manufactured are a little bit different, which leads to, and then the way they were studied were a little bit different. So that leads to why we get two vaccines of either the Pfizer or the Moderna, and only one of the Johnson & Johnson. And a lot of this was set up last April overall, so it takes a lot to change it. Yeah, I know there's a lot there, so I was trying to think of, those are some of the major things. And well, just go ahead and ask the question.
And along those lines, so that is, important distinctions, which then triggers, a couple of other subsequent questions for you. So one being, and I think Penn mentioned it in the past, where in the Hmong community, there's the distrust of, wait, why this vaccine for me if they didn't study it in me? And so I think one thing that's not thought about, this vaccine versus vaccines, polio in the past, where they studied, was there Latino, I won't say my age, gentleman that got studied before this came out? Was there African American? Was there indigenous? Were we included in this? And was that part taken into account when studying this vaccine?
Right, that was a major, and again, we're thinking of the ones in the US, but that was a major, one of the major things that was looked at within these vaccines. The three that we know of were not only studied in the United States, but in Brazil, the UK, South Africa. Now I'm mixing, each of them was a little bit different. But there was also very purposefully an effort to recruit people who were non-white of communities that were primarily impacted overall. And that's one of the reasons also I also became very involved in learning about the vaccine and understanding its effectiveness and safety, and talking to people in primarily the Black American communities also, because if we're disproportionately impacted by the virus, it's also important that we understand the impact of the vaccine on us. And that is, it's that push and pull is like, well, this is an experiment. There's a lot of historical and current reasons for not wanting to be part of it. But the answer is yes, there were goals reached. So I think that for most of them, and I haven't looked at the numbers lately, it was about 10% African American for the Pfizer and the Moderna, and closer to 25 to 28% Latinx or Hispanic overall.
And I think that goes to building the trust too, right? One, being included, but on the flip side, if looking at it that, you know, if I'm the devil's advocate, well, they tested on me, but not only me, right? Some of the mistrust in some of the previous inappropriate studies where it was just all Latinos that they studied. That I might be a little suspicious about, right? But me being included, and it's also the white counterparts, to me kind of lends itself like, hey, they looked at everything to look at, is it safe within all these communities for it? The question I get asked in the ED all the time is, well, I get it, right? And that's, I think, goes to that protein and the kind of the sample you're talking, the statement you're saying, it's not the virus. So can you get COVID with the vaccine? And if you tell me no, then why is it that I had a fever? Why is it that I had a, you know, sore arm? Why is it that for 24 hours I felt miserable?
I'll back up a little bit just to say how vaccines work. But the answer is that shows that the vaccine is working. But just to understand vaccines in general, I think it's important because I know a lot of the questions are, is it safe? And one of, you know, as I've had conversations and talked to, you know, tried to understand the question, you know, to me, there's a scientific answer for, is it safe? And I could quote you numbers and looking at, you know, how much fever or how much arm pain overall. But if you flip around the question and it's like, well, what would be unsafe or what would be the concern? I know a lot of questions have to do with, does it cause infertility? Or am I being injected with something other than the virus? Is blood being taken out, as was we heard earlier, being used for something else? So to go back to what is it that the vaccine is actually doing? And the answers to those are, is it safe? No, it doesn't cause fertility, and it's not injecting the virus. Our bodies are really wonderful. I mean, we have this immune system that helps clear out viruses, bacteria, anything that shouldn't be in our bodies. So if, for instance, to use the polio vaccine, if somebody had never had a polio vaccine but encountered polio as a virus, their body would build up an immune system, and like antibodies, cells would be prepared to clear it out. But that takes time. So during the period of time that there's the virus versus the immune system. But the vaccine it's a part of the virus. So when we get the vaccine, our body builds up immunity to that, so that if the real virus ever comes along, it will be attacked and cleared away really quickly. So what we do know about these COVID vaccines is that usually after the second shot, or if somebody's had COVID and they gets a shot, their body has already seen parts of the virus or the whole virus the first time. So the second time they see it, your body's ready to fight, ready to come up. And that's when you get the fever, the sore arm, maybe the chills. And not everybody has that, but a good portion of the people have that. And so it's really an indication your immune system's working.
And along those lines, if I get it and I don't have a reaction, does that mean it didn't work?
No, everybody reacts differently. It doesn't mean it doesn't work. It's just that, again, if you looked at the studies overall, some people got signs and symptoms, others didn't.
And I think that the important part of it is like you mentioned, in terms of the safe, like what does it mean by safe, right? In the context of I got ill for 24 hours or I had symptoms or a reaction, right? One of the other questions I got, and in fact, I thought it was kind of crazy. At first I laughed because I was delirious from having COVID, was people asking me, hey, could I come over? I want to get it. I want to get over with this thing. I want to get COVID and not. To me, it was a crazy, well, I got it, but that's not because I wanted to, because I don't know 10, 15 years down the line, is something going to be residual from having COVID? But is it, I guess, in your opinion, getting COVID better than getting the vaccine? And at the same time, if I had COVID, do I need this vaccine?
We've learned a lot about COVID-19, and we mentioned statistics overall, and getting the virus can be devastating. I mean, we know the statistics, the numbers of deaths. I don't know where we are now, in the hundreds of thousands overall. But also the fact that some people get it and get over it, and a large portion have long-term effects, and we're hearing about long haulers. I think the concern with that question is also that some people, like half of the people, can get COVID and not have any symptoms and do fine. But the risk of getting COVID is much, much higher than the risk of side effects of the vaccine. And again, the side of the vaccines are short. If you're able to take off the day after, not everybody is, after getting that second vaccine, those symptoms disappear very quickly. But also on a community level, having the virus, even if you don't have symptoms, you can still be spreading it to people who are going to be very sick with it. So side effects of vaccine are much more tolerable in the long run for the individual as well as the community. And the second part of your question was
if I had COVID, do I then need to get vaccinated?
The answer is yes, and that's based on studies that the immunity after COVID can be very variable from person to person, whereas we do know the immunity from the vaccine, we're still studying it, but it's still it's pretty long lasting and pretty powerful.
Okay. And you mentioned some of the questions that people had in terms of fertility, some of which again comes to cultural, because some might be more important than others, right? In terms of, does it affect me because I have these risk factors that we're talking about that could put me more susceptible to it. So am I getting that virus? You're not, in terms of that. And the long-term effects, I think, are the bigger ones for me, but we don't know, right? So I hope there's no long-term effects because I got it, but trust me, it wasn't because of choice. I wanted the vaccine. I just happened to get ill 2 days before, after a year of being in the front lines working, but got the vaccine thereafter for it. So the last question in terms of vaccines, and I'll open it to kind of individual stories in terms of, I think, people that want to tell their stories so that people can say, hey, I see you're like me, and I agree, this is why I should take it, is in terms of which one do I get? Right? And is there risk factors there? And I drew, one of my kids asked me yesterday, and she asked me, why was I laughing at a video, I forget what medication it was, where everyone's happy and it's supposed to change diabetes, but for a moment, it named every side effect possible. And we still take it, right? It shows blood clots, it shows all this other stuff. And I said, well, because even with the vaccine, there's always going to be some side effects, and it could affect people differently. But the goal that's overall is it safe for the most people, right? Because the question now comes, Johnson & Johnson versus Moderna versus Pfizer, which one do I take, right? Well, why? Before it was a convenience, I would take one versus not. But now, what would you tell people knowing what's out there, right? Because now there's a level of mistrust that came out, which in my opinion is part of medicine. What would you say?
So, I guess a couple months ago, when there was literally some places only had one vaccine and some had the other, the best vaccine was the one you could get, especially with these variants coming around. Getting the vaccine into arms was then and still is very important, because the sooner we can get up to a community immunity, it's important. Now there are options for choices, so that question becomes a little bit more relevant overall. Looking at vaccines, is it effective? And all three of these have been effective for what what the studies were actually set out to look for, and that's being seriously ill, being hospitalized, or dying. That all of them have shown that they're very effective, high 90% effectiveness for Moderna and COVID. And, there's a lot of nuances from numbers as to how to interpret the numbers. But, that's very important overall. So if one has access to Pfizer versus Johnson & Johnson or vice versa, they're all very effective in general. Now, the Johnson & Johnson is the one that is one dose, and that may just having that convenience, being available for many people may be is easier overall. So that's another reason to think about that. But from the safety perspective, I know the Johnson & Johnson pause is the big question that's out there. And the one thing to say about that, and if people have been following it, and we know that there was about a 2 to 3 week period that Johnson & Johnson vaccine was not being given because there was detected sort of a 1 in a million cases of these unusual blood clots. And the pause happened to allow everybody to really look at the data and to determine, is there a group of people who are more at risk? Is this greater than 1 in a million? How concerned are we? And to provide information. And that's on the backdrop of actually pauses happen a lot when you're developing medications or vaccines overall. But this one, the company and the people who are looking at this said, let's be as transparent as possible. Everybody has an eye on all these vaccines. Let's be transparent overall. So the final decision was really to undo the pause because it is very rare, but it's also recognized that it's more common in women under the age of 50. And so just to be able to give the information out there. So people and their doctors can make the decision about what's best for them. But I feel I've already had a vaccine, but I would get the Johnson & Johnson. I feel it's safe and effective.
I'll just a comment after that, echoing what Dr. Henderson saying. I got the Johnson & Johnson vaccine, and I just had a few little sore arm, headache, just feeling a little under the weather for a day or two, and then I felt better after that. One way to frame the pause with Johnson & Johnson, because I know there's a lot of questions about that, is that in some ways it can increase our confidence in the in our administration and the governing bodies that are looking at these vaccines. This pause was out of an abundance of caution. 1 out of a million people, there were just a handful of cases that this happened. So if they pause just to really look into it more, that lets us know that there are really people who are watching this very carefully. So that's one way to look at it. Another thing that happened during that pause, because these blood clots were so rare, it was associated with clotting, but also low platelets in the body, which makes you more susceptible to bleeding as well. Right. It's a very, very rare scenario where you have clotting, but you're also prone to bleeding. And so what they had to do during that pause was actually get massive educational information out to healthcare providers to know what to do when that situation arises, because the normal way that we treat blood clots, one of the normal ways that we treat blood clots, which is heparin, could actually make the situation worse in this rare situation. And so that just actually, even though the pause seems very scary, like, oh, there must be something wrong. One of the reasons for the pause too was to let emergency room doctors and other healthcare professionals know, even though this is very, very rare, if you get a patient with this, here is exactly how you should treat it so that our healthcare systems can be prepared. So that's just another way to kind of frame it and look at it, that pause in some ways could increase confidence.
And I would say along those lines also, in terms of the vaccine and its development, people ask, was it too quick, right? Did we skip any steps? And as I believe all the physicians could attest to, and pharmacists, in that there wasn't that, right? It was just the fact that, in a room when people get together and get committed to making this process go, to me, I'm like, look, we could do this for all of them, but we don't, right? We also take our time, we do other stuff, but not because of the science behind it, or not because we don't dot the I's, cross the T's in terms of a health perspective. It's more about, we got time. Why do I need to rush it? or I don't have the financial backing, so I have to figure that out, right? But I think in terms of the steps they actually took, they wouldn't have, if we then took a step back and we say COVID doesn't exist, but we want this COVID vaccine to be made for the future, the same steps would be the same things that they would prove that our vaccines have proven now, which is why one of the reasons I feel comfortable taking it, right? Regardless of the speed of the vaccine for it, because it is something that people talk about. Did it come up too fast? So in finishing here, what I would like to go, and again, because we have such a group here, if you guys feel comfortable, because this is not a sponsor, this wasn't a question that they told me to ask, but, if you guys can say, did you have COVID or not? Did you get vaccinated or not? And truly, what was the driving force for you, right? You know, and a lot of times, I kind of that moment of like, hey, the PC answered no. I want us to speak because the people, our community needs it, right? And to truly speak to them as to why we got it. And I will start with Dr. Olayinka. Hopefully I didn't mispronounce the name, but I also do want to give you some time in terms of your experience, and because that's one of the things that we wanted to get your experience as to why you got vaccinated and go. And sorry to put you on the spot here, but hopefully you're okay with going first and kind of truly saying to people so that they resonate. And it's not a commercial. It's not a, I'm paid to say this. It's none of that stuff. It's speaking from the heart because we care about our communities and we want to help them.
Thank you, Dr. Rodriguez. And yes, absolutely. So I didn't get COVID, but I definitely got the shot. I got vaccinated. I got the Pfizer and got both complete doses. And I already talked about that it's personal to me because I lost a family member to COVID. And so it's important to get vaccinated because I don't want to lose another family member. And the other reason why I got it is I have young kids. And it's important for me to know that I have that peace of mind. And when I go out and I have a possible exposure, I don't bring it home to the kids. And my risk of getting COVID gets reduced because now I got vaccinated. And that is something that when I see all my other family members who don't want to get it, I'm like, okay, forget about yourself. Think about your other family that lives with you. And so it's both a personal responsibility to our family, to my family, but also a responsibility even for public health. The thing that I don't want to put other people at risk of possibly getting COVID from me. And so it's one of the reasons I got it. Peace of mind is also another important one. And we've talked about the mental toll that having COVID has had on all of us as a society and as people. And just having that peace of mind, and yes, we still need to wash our hands and wear a mask, but knowing that I am not contributing to, we know the data, people are dying, but we want to avoid more deaths from happening. So it's important for me to have that peace of mind, knowing that I'm not contributing to more deaths, more hospitalizations, and also doing what is best for my family and what is best for public health.
Thank you. And Shiva, I'm gonna go through my my lens, which might be different than you guys. So I might put you on the spot without expecting.
That's okay. So I did not get COVID, and I feel like so incredibly lucky, right? Given where I work, what I've done during this time. So, which makes me even more filled with gratitude about being here today. And I did get I was in the vaccine trial. It turned out to be the placebo, which is the fake one. So then since they told me then I had the fake one, then I did get the real thing, which was the Pfizer, and I got the 2 doses as soon as I was able to qualify. And the reason I did it is I have not seen my parents now and my family for 2 years. They're far away, and I want to be able to get on a plane and be able to hug my parents who are 80 years old.
Thank you. Peng?
Yeah, thank you. Yeah, so I have not gotten COVID yet, but I did get the vaccine way back in February. And my second dose, I got the Moderna. And then my second dose, I didn't have as sore of an arm as my first one. I was a little fatigued the next day, but not fatigued enough to where I had to go shovel snow, because in February, if you remember, it snowed a lot. So I still shoveled snow next day. The reason why I got the vaccine is, one, as I mentioned earlier, I wanted to get it so that folks who are still on the fence of, is it safe to get or not to get? I got it so those folks can say, you know what, if Ping got it, then I feel safe, I should go get it too. I also got the vaccine because it helps protect me, right? So in the case that if I do get COVID, it reduces the severity or the impact COVID would have on me. And secondly, it also helps reduce the chance of me transmitting it to someone, right? Because the last thing I want to do is give it to a loved one unknowingly or a friend unknowingly. And so I wanted to reduce that chance of transmitting COVID to someone if I had it. And lastly, you know, I want to encourage everyone to get vaccinated, because by doing so, we all get protected from COVID, and then we can get back to as normal of a life as we can. And so those are all reasons, you know, good reasons to get vaccinated. And, you know, also with the, I wanted to share not with the vaccine, but with COVID, there's also been an increase in a lot of anti-Asian hate crimes. And I hope that by getting vaccinated and we can kind of move past this pandemic, a lot of that anger towards the Asian American can be more subsided with that, and really address some of the root causes why that took place. But because, you know, at the end of the day, words do matter and actions matter. And when elected officials call it the Chinese virus or the Kung Fu, it really only increases the blaming and some of the anxiety around COVID-19. And so I want to really encourage folks to, one, get vaccinated, but also really think about our words and our actions also.
Thank you. Corinda?
No, I did not have COVID, but I also live somewhat, and if people who know me know that I'm usually out in the community a lot, but when COVID hit, I was following CDC guidelines. I wasn't going anywhere. And so I wasn't even going to the grocery store. My husband was doing all the shopping because I'm like, I ain't going nowhere. Look, and so when they shut down the country, I said, this is serious business, because I know white folks don't shut down the country and lose all these dollars. So I said, and to me, I was like, they know something more than what they telling us. So that's why I'm like, I'm listening and I'm following the guidelines. So no, I didn't get COVID. I was one of the ones that was also on the fence about the vaccine. To be honest with you, I was on the fence. I was like, I had the chance to get it when it first came out, and I didn't. And I said, I'm going to wait and see. And then when my stepdad died, and then my father-in-law died within a week, and neither one of them died of COVID, but the fact that we had not seen them in a year before they died because of COVID, I was like, I'm not going to let that happen to my mother. Well, I want to see my mother. I want to see my siblings and my other family members, because I wanted to just be around them, because that's what I'm used to. And my mom only lives in Chicago, which is 2.5 hours away, but I didn't see her for a whole year. And so I'm like, no, that can't be life. And for me, I also felt like, one, I got it because my husband was like, you need to get that shot. And so I did get it. I got Pfizer, and my husband actually got Johnson & Johnson. So we had a mixture in our house, and I had side effects from Pfizer, from the second dose, where I literally was exhausted and couldn't get out of bed. And I had a fever, and I had a really sore arm. And my husband didn't have anything. Like, he basically was living like with Johnson & Johnson, he didn't get anything. But with me, I was out of it for a day, but then it actually miraculously went away the next day. So for me, that's why I got it, because he was pushing me to get it. And then when my father-in-law and my stepdad died, I was like, I have to get it. But I also felt like it was a responsibility of mine to be able to get it so that we could get back to some elements of normalcy. And I don't think that we're going to get back to where we were, but I do think that we need to get back to some new normal. And this isolation can't be that. So it has to be something different than this isolation that we've all been experiencing this last year. And so for me, that's one of the key reasons why I got it.
Thank you. And Pastor Allen?
Yes, I never had COVID. And I received the vaccine, I think back in the end of January, somewhere up in there. And I received the Moderna vaccine. First shot just had soreness on the arm. The second shot had some body aches and chills, but took a little Tylenol and ibuprofen, and I was good after that. I got the vaccine, one, to be an example for my community and my church, so that they can see that I trusted, and hopefully they'll follow my leadership. Some did, some didn't. Amen. And so that was one reason. Another reason was my mom, she had COVID in the early part of April of last year. And when you're talking about the health disparity system, the Milwaukee Fire Department went to her house, examined her, heard her lungs, and still didn't take her to the hospital. And like we said, it wasn't just history of the disparities of the health system, it's current day. And so I couldn't even see my mom, right? And while she's sick, I couldn't even, I wanted to drive down just to sit in the parking lot, even though I knew they wouldn't allow me to come in, but I just had to hit her with prayers from where I am. And so that was a reason why. And also for my children, I also got the vaccine. We see now our kids are suffering more than adults when it comes to mental health issues because of this isolation during this period of their development in their lives. So I got it for them, and so they can be able to feel safe when they go back to school, and hopefully many of the teachers got the vaccine too, so they can feel safe. So, and it's my prayer that those who desire it, and I'm gonna say this and I'll be done. I think most people that desire the vaccination have gotten it already. So the work really has to fall on us to tell the other people who are even hesitant about it or saying it's the mark of the beast. Marcio, when people say that, tell them they got the Holy Ghost. Please let them know they've been sealed with the Holy Spirit. Oh, this is Christian talk right here. I'm sorry. Please let them know if you filled with the Holy Spirit, the beast can't mark you. Amen. You've been sealed. And so we have to convince our people that too. So that's some of the reasons why I got the vaccine. And I want to travel. I'm tired of this house. Amen.
So going along with the Holy Spirit and the Holy Ghost, I'm going to go with Pastor Marcel. I'm going to lead it up to you in your experience.
I did get COVID. I think it was just before Thanksgiving. I got COVID, and my entire family did. My wife did. She still, this is almost 8 months ago. My wife, she still can smell or taste. And to be honest, I felt a responsibility for me because I was out in the community a lot, not in a responsible way, but I was helping with food. I was meeting people. I was sometimes going to the hospital. I was part of some funerals. And to be honest, when I got COVID and I knew that some other people got COVID, it was like, did I give it to them? Did I get it from them? And I felt like if I'm going to continue to be out there, I need to lead by example, and I need to take responsibility because a lot of people were depending on me. I was visiting families. I was delivering food to families that were afraid to come outside. So I saw it as a responsibility, but also we have a school, and we were having, that time in the summer, daycare and all of those things. I was very present with some of the kids. So I think the least that I could do is take the vaccine to try to protect those around me. But the other thing was, like Pastor Allen said, is to lead by example. Especially, in the church community, a lot of people were hesitant in the Latino community. So I saw it as a responsibility to me to lead by example and also not miss the opportunity. I have so many friends in Honduras and in other countries that are like, oh, you guys are so lucky, you guys are so blessed that you can get it. And to say like, yeah, we can go and get it, but I won't. I almost felt like, I have this blessing, take advantage of it.
Okay, and Lisa?
So I did not get COVID, even though my mom was in my home and had COVID. And I think it was her experience back in November that pushed me over. I was a little bit hesitant, to be honest, myself, but seeing how sick she was for 6 weeks and then being, transferred to a hospital in Milwaukee for medicine was pretty nerve-wracking. I have the Pfizer one, and I had pretty, honestly, bad side effects from the first dose. For 10 days, I had headaches and fatigue and brain fog. So that was challenging. So it makes me wonder if I actually did have COVID. I was tested negative, but it was a strong response. And I think being at the pharmacy school, we are leaders in this, right? You need to get the vaccine. And honestly, I've read a story about people being on a breathing tube. And I'm just like, I don't want to be that person. I can't be that person. So.
Okay, Dr. Henderson?
So I have not had COVID. I did get the Pfizer vaccine back in December when it first became available, being in healthcare overall. And for me, from a personal level, I remember when this first came out that Pfizer and Moderna were so effective. It was just like a big relief because I realized I had risk factors. I personally did not want to get COVID. I'm a single parent to a teenager, and a lot of my mind was like, so what would happen if I got really sick, that sort of thing. And I was keeping her inside, and sometimes I'm like, I know too much almost. So it was a relief to be able to get the vaccine overall. I have to admit that, I'd been following all the vaccine news overall. And when it came to, are you going to get the vaccine? I had to stop and say, am I really ready for this? And read the documents that came with the Pfizer and Moderna. And this is just to say that I had to go through the reading, and the fact that the results were so similar, and they convinced me, the documents convinced me that yes, these are safe and effective. I had no reaction to the first vaccine, but I slept all day I slept for 24 hours, had fevers and chills, but literally it was like 24 hours after the second vaccine, I felt fine, felt great. But then also, I think it was very important on the community level, when we think about how vaccines work also, that if I could be prevented from getting COVID and prevented from spreading to others, and to be able to talk to people and be able to answer questions about having received the vaccine, that's very important. Conversations like this.
Sorry, muted myself. Dr. Zapata?
Yes, thank you. I did get COVID along with my mom, my husband, one of my 3 kids, and I did get the vaccine. I got the Johnson & Johnson vaccine. And the reason that I ultimately decided to get it is because not only are they safe and effective, but also it's a powerful way to protect our community and ourselves. And when I think about protecting my community and myself, I just remember the night that I found out that I had COVID, and I looked down on my phone and it said detected. My heart just started racing, and I was so nervous because I didn't know if I was going to die, if a week later me and my husband was going to die and our kids weren't going to have parents, or what if I survived but my husband and my mom died. Like my mind just started racing, and it was horrifying. And so when I ultimately made the decision to get the vaccine, I said, I never want to be in that position again, to feel that way. And I want to be able to protect myself. a big event that happened in my life. I talk about it all the time because it really impacted me. My little 16-year-old brother passed away when I was about 21 years old, and we were best friends. We were like twins. Everybody thought we were twins. We were so close. And that was my mom's only son. And that was such a huge loss for our family. And we're still recovering from it over 10 years later. And so when I had that thought of what if I die? What if my husband dies? What if my mom dies? I said, I don't want to put my family through what we are still recovering from, losing my brother. And so that was ultimately one of the deciding factors to go ahead and get the vaccine.
Perfect. And I'll just jump in here too. So for me professionally, as doctors, obviously we're trained to look at things statistically, right? And to vet the information. And so professionally, I did do the same thing, Dr. Henderson. I'm assuming Dr. Zapata did too, in terms of looking at the data and saying, hey, is this safe, right? You have to have all those questions. And is it vetted throughout, right? Secondly, I saw, day and day, like I mentioned, people dying that shouldn't be dying, independent of race, color, social, like things. It was crazy in the emergency department. And we had to go. In the back of my head, all I heard was docs that got sick were sick. They weren't rarely, hey, the guys that like, I don't feel anything, I'll move on and go. And it weighed on me to say, like, as a leader, as a doctor, like, we have access. And I think Pastor Marcio says this, like, we have it. And it's the first time I could say as a Latino being like, I'm just in line with the white counterpart. I can get this that can help me and could prevent some of these deaths. And I knew that from coming from a doctor that was easier to get to, right? Because I knew the science of it. And I believe in the healthcare system. This is why I'm in it, despite the problems it has. Subsequently lost my uncle, was working the front lines, and he knew he shouldn't be out there. He was high risk, but he did it because that's what we're called upon to do. Then I got sick, and I'll spare you the story, but technically I should have been hospitalized and intubated, and all hell broke loose. Personally, that I'm lucky to be alive. And when they told me you need it a week later, I said, yeah, why wouldn't I? My body is already fighting. My body doesn't react to it. And I wouldn't look like the case that you talk about, other than being Latino. I don't have risk factors. So this is a global pandemic for a reason. It takes no prisoners. They'll do whatever you can. And you can't just say, well, my buddy is fine, or I had it, no big deal. It's do your part to keep yourself safe, especially if people depend on you. For my business, which I'm at now, if I wanted to run, if I wanted to interact with other people, I knew there's also the practical part of it, right? Like you guys mentioned travel, but what about running a business? Like seeing people outside of the hospital. When can I get people back in the gym doing stuff? And so I encourage people to really look at it and turn to someone that has some expertise in it, because they'll either talk to you about it or refer you to someone that has it. But to try to intervene from it's a political thing or misinformation that's out there, is to truly, like, how is it going to affect you? Because you might think it's a selfish move, but every selfish move is going to be a bigger move for everyone to get vaccinated and everyone to go back to our normal, which is going to be new. So hopefully this helped. Again, look at all these leaders that are doing it. We look like each other. We've had similar experiences, which is pretty cool to see. Hopefully you guys learn. Hopefully you guys, if you have questions or were hesitant, you're no longer. If you still are, I welcome all questions. Questions are good. And thank you. And I appreciate everyone's time. I know we went over, but I did want to hit your personal experiences. So I appreciate you guys all. Thank you.
This is 365 Media.